Hi there, welcome to Both Sides. I tell you what the doctors don't about dementia. Thanks for tuning in. I am really excited to announce that we are a month old. I started Both Sides at the beginning of April, so we're just about a month old. Up to 300 followers on Facebook. Thank you all for your support. Every day I'm inspired by the stories that I hear, by the expressions of love that I see, and so thank you for doing this and for showing up for your loved one in this way. I want to talk a minute about my business model. So it is a consulting or a coaching practice. Sometimes I call myself a navigator. It is a consulting service-based model, and the services have fees attached to them. They're outlined pretty well on my website. I actually am working on getting grant funding. I would love for this to be a grant-funded operation and not charge families at all. I'm a terrible capitalist. I really honestly don't like taking money from people, and I certainly don't want cost to be a barrier to families getting the support that they need. So I do offer my first sessions free. It's about 20 to 30 minutes or so where I uncover what your needs are and what the challenges are, what your goals are. Talk to you a little bit about how I work, and we determine if there's a fit and if I can support you. So please sign up for one of those if you haven't already, and let's talk through whatever's top of mind for you. And here's how I can help you. I can, first of all, educate. I'm also an educator with the Alzheimer's Association, and dementia is an incredibly complex and mysterious illness. It is a progressive and terminal illness. To date, there is no cure. There are medications that have been purported to kind of slow the progression of it, but they're hit or miss. So education about the disease itself, a roadmap for what to expect. It's hard to predict, obviously, exactly, and every case of dementia is so unique and different because people are so unique and different. But it does tend to follow a fairly predictable trajectory. And so I can help you understand that and see around what's around the next corner. Navigating the illness itself, understanding behaviors and symptoms, understanding the medications that are involved, navigating the healthcare system. Our U.S. healthcare system is pretty fragmented. You'll really find that once you become a caregiver and you're coordinating a lot of different resources and doctors and that type of thing. So I can help you navigate that system. I can help with family conflict also. Caregiving is so stressful. It's one of the hardest. Dementia and the whole experience is probably one of the hardest, if not the hardest, things that a family will encounter, and people respond to it in different ways. Some people are wired to be caregivers, hands-on caregivers, physical caregivers. Some are better at the business side of things. Some people want to be involved, some people not at all. So I can talk to you about what is causing the conflict in your family, help smooth over those interactions, and determine if there's a fit and what that fit is for each family member. I can help you advocate in medical settings. So you may be called to the ER a lot for crises. You may not be able to attend. Sometimes maybe something else is going on and you can't break away and your loved one is in the hospital. If you need a companion in the hospital with your loved one, somebody to educate, to take notes, that can be incredibly helpful. Also helping you prepare for these doctor's appointments as much as I'm able, giving you a list of things to be sure to consider and ask, and to remind you to always record everything and take notes and have everything in writing and documented when you do go to a medical appointment. I can help you with care needs, evaluating care needs, care environments, determining if in the home with home health coming in or congregate care setting, determine which is best for your loved one, what your loved one's preferences are for this type of thing. Hopefully you've had these important conversations. If you have not, and you're newly diagnosed or your loved one is newly diagnosed, please make this a priority. You need to understand what their end-of-life wishes are and what their wishes for the journey looks like. And then lastly, I can be a resource for other resources. So I can help point you in certain directions. There are a lot of things out there, that services and programs that people are just simply unaware of, that they can be leveraged to really help make your life easier. So I can help talk to you about what some of those are and understand if it would be a good fit for you. So once again, I want to thank you. I want to thank you for your support, and I wish you and your loved one and your family much peace. Take care.